Cholesterol is the other fat, and it's the fat that everybody talks about when they talk about heart disease. And cholesterol is a type of fat. It's waxy, it's yellowish, and what it does is it forms a honeycomb pattern inside the artery. So it forms the structure, and inside that honeycomb pattern, very much like the bees put, what do they put? Honey inside the panel of the beeswax.
28115.
Sorry about that. I'll repeat what I said. So the cholesterol forms the structure, and very much like the bees put the honey inside the structure of their beehive, we inside that cholesterol structure put calcium deposits, triglycerides, and other things, and fill in those holes in the structure. And without the structure that the cholesterol provides, it wouldn't be so easy to get clogged arteries, and that's why cholesterol is so bad. Your body makes 2/3 of the cholesterol you need every day, and you're allowed to consume 1/3 in your diet. Okay? The 2/3 that you make every day is approximately 300 milligrams, and the 1/3 that you're allowed to consume in your diet is about, the 2/3 that you make every day is approximately 600 milligrams, and the 1/3 that you're allowed to consume is approximately 300 milligrams. So on any given day, you're going to use up about 900 milligrams of cholesterol. Cholesterol, by the way, if you've ever seen an egg yolk, that you were eating eggs in the morning and your mother said, you got to go to school, you got to get out, you got to go to work, and you leave, and you come back at 6 o'clock that night and no one's cleaned up your plate, and you take the plate to the sink and it's that sticky, yellowish, waxy kind of thing, that's exactly what the cholesterol looks like. Your body makes it, and you're allowed to consume a certain portion of it. The problem is that on any given day that you don't consume cholesterol, your body still has the ability to come up to bat and make the total amount that it needs. So it's very hard to put the body in a cholesterol deficit. You can lower what you eat, but some people, even though they lower what they eat, their body comes up and makes up for the difference. So sometimes when your problem is that your own body's making too much cholesterol, what the doctor will do is he'll prescribe a statin. There's many statins, Mevacor, Lipitor, Crestor, Simvastatin. There's a whole host of these medications. And sometimes they are necessary because just genetically your own body is making more cholesterol than you need. So the statin will lower the amount of cholesterol your body makes, and then what the recommendation is that you consume no more than 200 milligrams of cholesterol a day to lower the amount that you're consuming. So by lowering both sides, hopefully then we can put you in a deficit and we can start pulling from what's already clogging up parts of the arterial system. The only food that I ask my patients to give up is an egg yolk. And the reason that I ask patients to give that up is because we're asking that you eat no more than 200 milligrams of cholesterol a day, and one egg yolk is 216 milligrams. Now I know, I come from an island myself, and eggs are high up there in terms of being very nutritious and very wonderful, and people think very fondly of eggs. But the whole world is getting very industrialized and very technological, and our genetics haven't been able to keep up with our technology. As a young girl, my grandfather used to go out and tend the fields and climb mountain ridges and do very physical things as part of his daily work. Today, he'd probably be sitting behind a desk at a computer. So the eggs that he could get away with consuming back then, when he was so physically active, are going to be much reduced today when we're not so physically active. And the reality is that all over the world, people are getting less physically active because of the conveniences that technology has brought along. So at this point, I ask people if they think an avocado has cholesterol, and the usual answer is yes. And then I ask them if peanut butter has cholesterol, and again the usual answer is yes. However, the right answer would be no. And there are a few things in life that are black and white, and this is black and white. If you learn nothing else from this lecture, learn this. Cholesterol is only found in foods that come from animal products. A food can come from a plant, like olive oil, like corn oil, and it can be 100% fat, but it cannot have cholesterol. The only time a food can have cholesterol is if it originated in an animal. Okay? So, if someone puts an avocado in front of you, you're going to ask yourself, did that avocado ever walk, fly, or swim? The answer is no, and you haven't had a little bit too much to drink and maybe imagine one flying, walking, or swimming, then you know that it doesn't have cholesterol, because anything that comes from a plant cannot have cholesterol. So your question always is, did this ever fly, walk, or swim? If the answer is no, it cannot have cholesterol. If the animal walks, it has the highest amount of cholesterol in the food supply. So here we're talking about pork and goat and beef and some other four-legged creatures we might consume. So your leanest cut of red meat will always have more cholesterol than an animal that flies. If the animal flies, it has a moderate amount of cholesterol, and fortunately most of the cholesterol is in the skin. So you always want to take the skin off before consuming. And if the animal swims, you can basically eat it to your heart's content. It has the least amount of cholesterol in the food supply, plus it's chock full of those marine oils that are anti-inflammatory and are very good for your vascular system. So again, if the animal walks, it has the highest amount of cholesterol in the food supply, and it's equivalent to whole milk. If the animal flies, it has a moderate amount of cholesterol, and it's equivalent to low-fat milk. And if the animal swims, it has the least amount of cholesterol. It still has cholesterol. It is an animal. And it's equivalent to skim milk. The shells, the oysters, the clams, the mollusks, the escargots, scallops, the shells are the vegetarians of the sea, and they have even less cholesterol than fish. So those are very wonderful to enjoy, regardless of what you may have heard before. They are wonderful to enjoy. They also have the marine oils that are very beneficial for your vascular system. The three that confuse everybody are the shrimp, lobster, and crab. Now, shrimp, lobster, and crab actually have more than 4 legs, and they actually have more cholesterol than red meat. But when you categorize them, you put them just under red meat because they have the marine oils. And what the marine oils do is they neutralize out some of the cholesterol that those animals contain. So shrimp, lobster, and crab in moderation. Don't wait until the crabs are in season and then we can't find you under all the shells. You want to just make sure that you have those like red meat. The recommendation for red meat is no more than 4 times a week, and the portion size would be about the size of a pork chop. If that's not enough to fill up some of you rough and tumble guys, you might want to think of a surf and turf combination so that you get full and satisfied, but you don't have excessive amounts of red meat. Plants, on the other hand, can be 100% fat, and I already gave you some examples. Olive oil, corn oil, canola oil, sunflower oil, all the cooking oils. They all come from plants. So they are 100% fat, but they have 0 cholesterol because plants don't go around eating people, and plants don't produce their own cholesterol. So even though something can be 100% fat, it doesn't necessarily have to have cholesterol. There's some fats that when you go to the supermarket, you'll see it on labels: saturated fat, polyunsaturated fat, monosaturated fat. The fats that are bad for you are the saturated fats and the trans fats. Saturated fats basically were lard, and that's really the primary saturated fat. If you do a barbecue and you put your ribs to grill and the pan is sitting there and you see the white fat come up to the top and form a crust, that's saturated fat. Saturated fat is very damaging to the blood vessels, and it makes the cholesterol stick. And we should have as little saturated fat as possible. The trans fat is when some brilliant American entrepreneur said, lard is bad for you. What if we take corn oil and put it through this machine and make it into a solid? And out came Crisco. And I'm sure some of you remember the Crisco in the blue can, which was the vegetable shortening, which had no cholesterol and doesn't have cholesterol. However, it is a trans fat, and your body can't distinguish between a trans fat and a saturated fat. So even though they can put on the tub of vegetable shortening that it contains no cholesterol, unfortunately it has the same cholesterol effect. Some European countries have banned trans fats from their food supply because they are so damaging. It is the only man-made fat, and your body has no way to transport it, so it goes in and it stays. Every other fat, which is a nature-made fat, has a way of going in and coming out. But the trans fat just goes in and stays, and it's a very damaging fat. And if you see it on a label, then you really shouldn't be buying that product.